friends, today we are going to revise the cranial nerves, 12 pairs of cranial nerve, forebrain 2 pairs and brainstem 10 pairs. So firstly, what I gonna tell you the names, and then I will tell where they are present, what are the locations. Okay, the first nerve is the ophthalmic, olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory and hypoglossal. You can learn this by a trick called Uta Fagwa. U U U Tra Fa Gua. So olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, and this is auditory, glossopharyngeal, vagus, accessory, and hypoglossal. Okay, so forebrain contains 1 and 2, midbrain contains 2 and 3 and 4, sorry, 3 and 4. Okay, and your 5, 6, 7, 8 are present in pons, and 9, 10, 11, 12 in medulla. Okay, so here you can see olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear, also called as auditory, and glossopharyngeal, vagus, accessory and then hypoglossal. So hypoglossal comes between pyramid and olive of the medulla. Functional components consist of motor fibers, motor nerve, sensory fibers, sensory nerve, both sensory and motor mixed nerve. So you can learn the mixed nerves by Hindi pasand, P for 5, S for 7 and N for 9 and the for 10, 5, 7, 9, 10. 5, 7, 9, 10 are the mixed one. And okay, motor nerves, somatic efferent, general somatic efferent. So the columns number are GSE, you can see, say supply striated muscle which develop from somites. So GSE column contains 3, 4, 6, 12. 3, 4, 6 and 12. Okay, nerves. And now spatial visceral efferent. A spatial visceral efferent supplies muscle derived from mesoderm of the pharyngeal arches. A spatial visceral efferent SVE supplies 5, 7, 9, 10 and 11, and these three are called nucleus ambiguous. Now general visceral efferent. General visceral efferent GVE column supply glands, smooth muscles and vessels. So the values are 3, 7, 9 and 10. 3, 7, 9 and 10. Okay, and these are parasympathetic fibers, like this 3, it's supplying your ciliary ganglion, 7 it's supplying your submandibular ganglion, and 9 is supplying your otic ganglion, and pterygopalatine supplies is by 7th nerve. Okay, now sensory fibers, general somatic afferent, GSA column, GSA column, general somatic afferent, carry general sensation of pain, touch, and temperature from skin and proprioceptive sensations. So, GSA column are 5, 7, 9, 10, and 11. GSA 5, 7, 9, 10, not 11. And general visceral afferent, general visceral afferent, GVA, sensations of distension and ischemic pain from viscera. GVA root value is 7, 9, and 10. And SVA also contains the same fibers, carry spatial sensation of taste from tongue, spatial visceral afferent. Okay, now we will see olfactory nerve. Frontal air sinus, olfactory nerve, olfactory bulb, olfactory tract, ophthalmic mucous membrane, sphenoidal air sinuses. First, cranial nerve, sensory and carries senses of smell from nasal cavity. Primary sensory neurons of ophthalmic nerve lies on the body surface in epithelium lining of nasal cavity. They carry spatial sensation of smell from ophthalmic olfactory region of nasal cavity and terminates in olfactory bulb. Primary sensory neurons of olfactory nerve are continuously replaced by stem cells in olfactory neuroepithelium. Courses. Each nerve's 20 minute bundles of non-myelinated nerve fibers arise from primary receptor neurons of olfactory epithelium of nasal cavity, pass through foramina in cribriform plate of ethmoid cranial fossa anterior and terminates in olfactory bulb. Anosmia. The loss of sense of smell is called anosmia. Anosmia can occur for a number of reasons such as atrophic rhinitis, degenerative disorder of nasal mucosa, fracture of the anterior cranial fossa, ethmoidal fracture, etc. The ethmoidal fracture is often associated with blood-stained cerebrospinal fluid, CSF rhinorrhea. Clinical testing of olfactory nerve. The olfactory nerve is tested clinically by asking the patient to smell common odors such as peppermint, garlic, or cloves from each side of his nostril separately with eyes closed.